The CDC's Youth Risk Behavior Surveillance Survey is given to students every 2 years to measure risk-taking behavior. It covers topics like injury and violence, substance use, sexual risk behavior, and mental health. The CDC just released results from the 2021 Youth Risk Behavior Surveillance Survey, which we are going to discuss in more detail. One of the most striking findings was the extent to which depressive symptoms are a concern for our students. The YRBS uses proxy items, persistent feelings of sadness and hopelessness, as indicators of depression. We've seen data for a while now indicating that many students are struggling with depression, and this trend appears to continue. More than 2/5, 42% of students reported signs of depression in 2021. And we know there are differences based on student identities. More than half of female students experienced persistent feelings of sadness or hopelessness in 2021. Now, this was true for more female students experiencing these feelings relative to male students, and more Hispanic students experience these feelings relative to white or Black students. This also varied by sexual identity and by sex of sexual contacts as well. So for example, lesbian, gay, and bisexual students were more likely than students not sure of their sexual identity, and twice as likely as heterosexual students to have experienced feelings of sadness or hopelessness. Students not sure of their sexual identity were more likely to have experienced persistent feelings of sadness or hopelessness than heterosexual students. Suicide is also a very serious issue for students. In 2021, 10% of high school students attempted suicide. Suicide is the third leading cause of death for 15 to 24-year-olds in 2020, falling just under homicides and unintentional injuries. The rate of suicide among middle school age students tripled from 2007 to 2017. And I want to remind folks that these numbers are prior to the pandemic. That's important because we know students struggled with their mental health during the pandemic. And although we won't know how the pandemic affects rates of mental health challenges and suicide for a couple of years, these trends were clearly already underway prior to its start, and the pandemic likely exacerbated these trends. So let's take a look at these trends in a little bit more detail to help put this data into context. Now, the results reveal that there hasn't been much progress made in mental health and suicide-related behaviors and experiences reported by students over the past decade. Unfortunately, most indicators of mental health and suicide have shown increasing trends, which really is of great concern. I think the data trends highlight student behaviors and experience where increased support from schools, communities, and families is needed. But just looking across the board here, more students experience persistent feelings of sadness or hopelessness from 2011 through 2021, regardless of race or ethnicity. Nearly 60% of female students and nearly 70% of LGBTQ+ students experience persistent feelings of sadness or hopelessness. Almost 1 in 4 students seriously considered suicide, and an increasing number of students made a suicide plan from 2011 through 2021. 10% of female students and more than 20% of LGBTQ students attempted suicide. Now, how can we utilize this data? The YRBS can be used to support your comprehensive school safety plans based on local school and community data for youth. These areas include having conversations with key partners and decision makers, for example, public health organizations, education organizations, community groups, parent groups, who can help improve adolescent health behaviors. We can think about using the data to identify and address adolescent health disparities for your local school context, or to inform the development of evidence-based policies to address sexual risk, substance use, violence, and mental health, including suicide prevention among youth. And we can also use the data to inform resource discussions for school-based or community programs that protect and support student health and provide needed services, and also promote awareness and bring the community together to address gaps in the health needs of students. I want to remind you that this data is available from the CDC at www.cdc.gov/healthy youth/data/YRBS.